Thank you so much, Michael. It's a pleasure to be here today, and I want to greet everyone that's joining us in the webinar. Such a pleasure to be together and to be able to talk to you about LifeSTEPS and our Housing Plus Services RN coaching program. We are so pleased to be award winners and want to thank NEHA and HUD, and just excited to be here today. So first, I would like to share a little bit about LifeSTEPS. We are a nonprofit organization, and it is our mission to provide effective educational and supportive services to maximize the strengths of individuals and to build resilient communities. We provide our social services at 340 plus communities in California, including wraparound social services, as well as supportive services to special needs populations. Our partner in this pilot program for which we won the award is USA Properties. We've worked together since 1996. USA Properties is one of the largest developers of senior affordable housing in the United States, and their mission goes well with ours, and their mission is to create outstanding communities. Working together, LifeSTEPS and USA Properties have decided to invest our own financial resources to create this pilot program of Housing Plus Services RN coaching. Many of you may have heard of the HUD program I Wish with wellness nursing, which is another wonderful model. Our program that I'm talking about today is distinctive because it's offered in a various group of income for affordable housing, ranging from project-based Section 8 to 60% AMI units. And this is important because many times our 50 and 60% AMI unit residents have income that's slightly too high to qualify for Medi-Cal or Medicaid, and they are not able to access the community-based services that go along with that program. We wanted to try and see how we could impact the lives of residents with various incomes. Philosophically, our two companies have a lot in common. Both USA Properties and LifeSTEPS like to be innovative in affordable housing. And with this program, we wanted to see how we could be good financial stewards and also increase the dignity and health of our residents. So we came together and wanted to create this idea really because we were concerned that over 20% of our older adult residents moved out for health-related reasons. And this was a really just tough situation for our residents, our staff. People were sad. They wanted to have their apartment communities be their forever homes, and they didn't want to leave. And then the residents that remained were sad to see neighbors go and also feared for their own ability to age in place. So we created this program with a threefold intention. First, to enable our older adult residents to remain independently in affordable housing, to help them avoid unnecessary and costly healthcare services, and then also to create communities of wellness where residents had the tools that they needed and the support to manage their chronic conditions and even improve their health status. So the big picture is that people from backgrounds of poverty need access to on-site relationships, and I just want to emphasize that on-site component. On-site relationships marked by caring, trust, and accountability. And so when we created this pilot program, the configuration was one registered nurse partnering with property management and service coordinators at 3 apartment communities in the Sacramento area. Here's a summary of our journey throughout this pilot program. We started out with a business plan and needs assessments, and then moved into program structure and workflow, and are currently working on sustainability. The core of our pilot program that won the award is the interdisciplinary team, comprised of USA property managers and maintenance technicians that were making the essential referrals and also modifying apartment units, the LifeSTEPS service coordinators that implement the referrals for social needs, and then our new staff member who is the RN coach, focusing on the healthcare navigation and health improvement. And of course, our residents were also so critical in co-designing the program through the needs assessment process and then referring neighbors to the program as our reputation and success grew. During the needs assessment program with RN coaching, we found that there were common barriers. We confirmed that low health literacy was an issue that our residents were dealing with. They were intimidated by medical terminology and the healthcare system, meaning that they got stuck in confusing and systems and red tape and would often give up even though they were trying to access their care. One of the things that did surprise us was that residents shared that they had a lack of honesty with their providers. Oftentimes when they weren't able to manage their chronic conditions, they didn't want to disappoint their provider or they didn't want to get a lecture, so they were not having those truthful dialogues so that they can improve their health. And that really led to many ineffective provider visits. Even though they were going to the doctor often on a regular basis, the outcome wasn't beneficial. I know many of us are already familiar with property management and service coordination, so I wanted to talk a little bit about what RN coaches do. Unlike the acute care and long-term care settings, RN coaches do not provide direct medical care. They really focus on helping residents to improve their self-management skills, enhance care coordination and patient-provider communication, and then support effective care transitions from hospitals and long-term care facilities back to independent living. I wanted to tell you all the story of Nancy to illustrate some of these facets of RN coaching. LifeSTEPS resident Nancy received this bottle of medication through mail order, so she didn't have a chance to talk to her physician about it or to talk to a pharmacist. And as you can see, the instructions are quite amazing. Take 1 capsule orally daily at bedtime for 3 to 5 days. If tolerated, increase to 1 capsule 2 times a day for 3 to 5 days, then 1 capsule 3 times a day, so on and so on. Nancy did her very best to take this medication as prescribed, but she was having terrible side effects. And property management noticed right away she was not doing well, she was not taking care of herself. So they gave a just-in-time referral to the RN coach. The RN coach met with Nancy to talk about the side effects of the medication and validate that the label was too confusing for anyone to follow, and really motivated Nancy to get back in touch with her healthcare provider. The provider decided that the medication wasn't worth the side effects and told her to stop taking it. And since the medication cleared her system, Nancy experienced fewer depressive symptoms, was able to get sleep again, and organize her apartment. And she shared with us that LifeSTEPS helped me get back to being me. Our intervention continued with the LifeSTEPS service coordinator helping Nancy with her essential needs like food and transportation and in-home services. And since becoming involved with this intervention, Nancy's quality of life improved to the point where she was able to volunteer again. She socialized with neighbors again and was coming back to the clubhouse again. And this really helped restore hope not only for Nancy, but for the apartment community as neighbors saw her return to health. So RN coaching doesn't provide direct clinical care, but does definitely interact in the clinical sense of helping residents prepare what to say during their doctor's visits ahead of time so they can make the most out of their 10 to 15 minutes. Again, cutting through that red tape when referrals are lost or a wrong procedure is ordered, the RN coach helps residents navigate. She also helps people understand their new diagnosis. Sometimes they're getting news that they have diabetes at this doctor's appointment and are confused and overwhelmed by the time they get home. She sits with them and helps them digest this information and come up with a plan. And also, like I said, transitions back home from long-term care and hospital. The RN coach actually goes out to these facilities, meets with the resident and the care team, comes up with a care plan, and then coordinates home care and education when they get back home so they're not bouncing back to the hospital. This is exactly what happened with our resident Jim. He was hospitalized for respiratory distress and came home with order to use a nebulizer. The nebulizer was mailed and put on his porch the next day, and when Jim opened the box and didn't realize that he couldn't get it back together, he didn't know how to make this machine work, and the instructions were in 4-point font that he couldn't read, he knew right away to call the RN coach, who he was already familiar with because she was a trusted member of the community. She was able to explain how to use it, how to clean it, and continued on with education on COPD, and all of these things helped Jim stay at home and not bounce back to the hospital. So a hospitalization was avoided. RN coaching also touches a lot on modifiable health behaviors, and we discovered that issues of all sizes can make a huge impact. A lot of times residents receive strips that don't match their glucometer machines and won't work, and so the RN coach helps them sort that out with their health plan. Also, we discovered that a lot of residents had blood pressure cuffs, for example, and were supposed to take their blood pressure on a regular basis so that their medication could be managed by their provider, but they didn't have batteries and didn't have a good way to go to the store to get batteries. So we started providing batteries as a very simple intervention so that people can manage their health. Also, residents often ask the question, not in these exact words, but in many different ways, am I worth the effort it takes to have better health with my chronic conditions? And with RN coaching, the answer became yes. Residents were encouraged to make goals, to believe in themselves, to realize that they could have dreams and goals with better health. And ongoing coaching on site with that constant access helped residents gain knowledge, have the accountability partner, and also celebrate good changes. One of the core components of the program was also chronic disease education. The RN coach educated property management and service coordinators about what to look for when residents may be experiencing these conditions to make quick referrals. And also residents were educated so that they knew how to manage and how to interact with their providers. And this really created a culture of health with entire communities concerned about their own health and their neighbors' health in a very positive way. At one of our sites, residents even during morning coffee time began to ask themselves, what are you doing for self-care today? People were looking out and really wanting to have a change for the whole community. Of course, the physical environment is also very important in aging in place. And a simple change, as we all know, can make a huge difference for people and to be the difference between independence and hospitalization and injury. USA Properties Management did change physical environment modifications, like lowering a tub to give older adults with functional impairments access and reduce their risk of falls. And another example is upgrading a flashing light so that hearing impaired residents are able to know when they have a visitor or a service delivery. As we entered into the third year of the program, we realized that we really wanted to be a partner with the local academic institutions for workforce development so that future RNs and gerontologists would have the opportunity to have a lens of community health. We discovered that most training was in the acute care, and we wanted to offer this as a platform so that people would realize that housing is a hub for healthcare. So we have relationships with the UC Davis School of Nursing, Sacramento State Nursing and Gerontology students, as well as Samuel Merritt University. And this was a wonderful thing. Residents so enjoyed being able to give back to the students and train them for their careers. And the students love seeing how a single nurse and a single service corridor can improve the health of an entire community. So I'm thrilled to share today that the program was very successful and met its intention. The number of residents moving out because of healthcare needs was reduced by almost 70%. So we were able to affirm that with the RN coaching intervention, aging in place was positively influenced. We also were able to track outcomes and develop our outcome mixed method evaluation and see that the program succeeded in helping people have positive health outcomes, like I've mentioned, and also having an annual estimated cost savings to the healthcare system of over $1 million a year. We believe that the future of Housing Plus services with RN coaching is bright. We did conclude our self-funded pilot program in March, and we are continuing to advocate for sustainability. The California Master Plan for Aging, which will be published in December of this year, is a blueprint for our state and local governments. And it really does call for housing with enriched services, and stakeholders, including LifeSTEPS, continue to emphasize the importance of housing as a hub for healthcare. LifeSTEPS and USA Properties are continuing to seek sustainable funding. Our advocacy had led to SB 1292, a legislative package that would extend our pilot program concept into a 5-year, 5-county demonstration project. This bill was co-sponsored by Leading Age California and many other supporters. With COVID-19, our state's legislative priorities, like the rest of our nation, were reshaped. So this legislation is tabled for now, but we are going to continue to seek support. And next, I would like to show a video of our resident, Gail, who will talk about her experiences with RN coach Stacy.
I was introduced to Stacy about a year ago, and I was having a lot of trouble with medications. My doctors weren't answering to my orders or anything, and I had heart medication I needed to be taking, bipolar medication, and those two combinations by themselves felt deadly. So I talked to her. She had noticed something was wrong with me, and we sat down and talked, and she got on the phone right away, and everything got taken care of. She ordered my she had the doctor's order that she talked to order my medication, and it was ready pretty quick, and she went down and picked it up, and she brought it back to me, and we got my meds straightened out, and I started feeling better, and I thank her very much for that. My appendix had burst, and she would come every single day and check paperwork, from the other nurses and stuff. They were coming around, and everything was in order, and she checked my blood pressure, everything. It felt very wonderful to have somebody care so much like that when you're sick. You just don't really expect it. Not even in some hospitals, you don't. you don't get that treatment. But here we do.
Well, I want to conclude by saying that our continuing goal is to reshape health education, coaching, and navigation into a service that takes place on site in affordable housing communities in California and hopefully nationwide. Thank you so much, everyone, for your time today. Again, I'm so honored to accept this award, and it's been a pleasure. I look forward to hearing the other presenters.